There's a lot of restaurants in Hamilton. So how are you guaranteeing that the food handlers in those restaurants are inoculated against the disease?
Well, there's nothing in the Hamilton Township Code or the state of New Jersey statutes that require a Hep A vaccination.
So this could happen again?
Yes, we have, through our office, at the mayor's suggestion and Mr. Flynn and Mr. Ricky's suggestion, sent out a letter to each and every one of our food establishments. Recently, within the last 2-3 weeks after the initial incident in Roses, explaining what happened, what needs to be done, what our recommendations are, and to consider inoculating their entire staff.
Will you go and follow up and check to make sure that's done?
All restaurants are inspected yearly, some twice a year, and that's checked to see if they have done that. Again, we cannot mandate that. We can recommend it.
Now, regarding the Y, I called my primary. They don't have it, okay? So I have to go to Rite Aid. But seeing that there's a lot of people at the Y indiscriminately may get it, wouldn't you think it's prudent to give inoculations out to the members of the Y?
No, I do not. Again, we're within the case definition of primary contact. And if you're a member of the Y or a guest of the Y, you are certainly not a primary contact. You're a second, third, possibly fourth down the line.
So that'll change if somebody contacts you that wasn't in that class.
That will be handled on a case-by-case decision at that time. Yes.
Jeff, Ken, and I know you already answered it one time, but can you articulate for us again why this doesn't rise to the level of having another clinic with some of those shots? I believe you used 700 on the last round of 1,000. Why wouldn't you go ahead and do that at this point?
Because in this point we have a defined population of contact. The airport, the employees, the patrons. That's a direct contact defined. In the restaurant, it was an open public place where anyone could walk through, the entire population could go in, and that changes our perception of what our target population was, as well as the State Department of Health's idea of what our target population would be.
What's the message you want to get out to the public overall, whether they frequent these facilities or not? I think a lot of people are kind of at a heightened concern right now.
I think the message has always been personal hygiene, wash your hands, no matter what you do. Be diligent, be concerned, look where you go. You know, we do not have a restaurant rating in Hamilton or the state of New Jersey, as New York City has A, B, C, D, E. Ours is satisfactory, conditional, or unsatisfactory. You know, be aware of the rating of your facility, ask questions. But again, personal hygiene, don't panic. It's a case that illness that you certainly will recover from. We don't want anyone to do it, but our personal hygiene issue continues to be the most important thing.
How concerned are you, if at all, and both of these women you said thought they had flu-like symptoms. This sounds like it could easily pass for the flu, and then suddenly you're a couple of weeks into it and you realize, see, this is even getting worse and so forth. How much of a concern or a challenge is that, the nature of this disease and how closely it resembles the flu, at least early on?
That's what both of these women thought they had, was the flu, and it's flu season, so that's certainly a possibility.
They might have delayed taking any action because
They
of
both did delay.
Is there anything that sets it apart, Jeff, for anyone out there that's feeling those flu symptoms? Is there any other symptom that sets it apart to give you that indicator, that red flag?
Not really. Again,
Is that the hard part for you guys?
That's the very hard part. And both admitted that they thought they had the flu, and the parameters are almost identical.